Good evening, everyone, and thank you for joining us on behalf of Heart Support Australia for another Heart Support Connect session. In actual fact, our last one for 2025, which we do in partnership with the Solve CHD Research Group out of the University of Sydney. My name is Christian Beakey. I'm the CEO of Heart Support Australia. And before we get started, I'd like to acknowledge the traditional custodians on which the lands we're meeting today across the country, and pay respects to elders past, present, and emerging. We have a really interesting topic today. We have Dr. Nikky Gordon joining us, who is a clinician researcher and accredited exercise physiologist, who's taken a keen interest in improving access to cardiovascular rehab and secondary prevention programs, especially for disadvantaged populations. She has worked clinically for 10 years in the public system and private practice, including run her own clinic, which is focused on helping people with cardiovascular conditions in the metropolitan and rural locations. She has active advocacy roles that aim to improve equity, both for health professionals and patients in healthcare, and her current research focusing on access to cardiovascular rehab and secondary prevention programs to people living in rural and remote locations using co-design, digital health and technologies. Nikky is based in Western Australia, and we'd like to thank her for her time this evening and welcome her to be our guest speaker. So thank you, Nikky, and welcome.
Thank you, Christian. Looking forward to it.
I will now make you the host, and it's all yours to take over.
Thank you. All right. Apologies. There we go. Okay. Cool. Now I hope that you can see my slides.
Perfect.
Yeah. All righty. So I'm going to chat today about digital technologies in heart health, particularly focusing on exercise and physical activity. There we go. I'm going to start off with some quick definitions, different areas of physical health, why physical health is important. I'm hoping to introduce perhaps a few things that you may not be aware of rather than harping on the same reasons that you probably already do know, and then how to assess and measure physical health, including using devices and digital technologies. So just quickly, the difference between physical activity and exercise. So physical activity is any bodily movement that uses energy. It can be as simple as fiddling, twitching, and then or walking from place to place. And then exercise is specifically for health benefits. So it's when you go out for a purposeful walk at a moderate intensity for health benefits such as improving your fitness. So when we think of the guidelines, they're actually referring to physical activity. So it doesn't necessarily just have to be structured exercise. As such, it does include things like gardening, and we'll touch on that a bit more when we go to the assessment stage. But I think that's probably reassuring for a lot of people when we think that it's 150 minutes of moderate intensity physical activity per week. When you think about it, it's all the movements that you're doing, not just the structured exercise. I think it was hopefully calms the nerves a little bit with how much you feel like you need to do each week. So the different areas of physical health. So cardiovascular fitness is probably the main one that you're aware of, having done cardiac rehab. Other important aspects, not just for heart health, but generally as well, include muscular strength, bone health, balance, and flexibility and mobility. So reasons why it's important. So overall health and well-being, mental health is a big one, and there's more and more coming out in the research to say that an exercise program or being physically active is just as beneficial as talking therapy and medications for improving depression and anxiety, which is reassuring because there's little to no side effects for exercise, as long as you don't do too much too soon. Chronic disease development and progression, you're probably well aware of these, but some of the main ones are heart and lung disease, diabetes, and dementia has a big link with exercise and physical activity. The fitter, stronger, and more flexible you are, the easier your everyday activities become. So that's really important, particularly if you're getting older and you want to continue living by yourself. These aspects of physical health become really important in those situations. We have the social interaction and connection, if that's what you're looking for. Not everyone wants that. It is important to have the social connection. Not everyone wants to do that in the exercise and physical activity space. Surgical outcomes is another big one. So if you're fitter and stronger, then if you have to go to hospital, your length of stay is usually shorter and you have less complications associated with surgeries. Cancer development and treatment is another one that's growing in popularity, and exercise and physical activity have particularly been linked with bladder, breast, colon, endometrial, esophageal, kidney, and stomach cancers, none of which you would probably typically expect from exercise, but it just shows that exercise has a big effect on your overall body functioning and your immune health as well. So I'm going to touch a bit more on fitness. So this recent study, so it was published last year in the British Journal of Sports Medicine, and it basically looked at, it did an overview of all the overview studies that are out there. So there was over 20 million cases that they looked at from almost 200 different research studies. So there's a lot of data that they've looked at, and higher fitness is strongly and consistently associated with lower risk of dying prematurely, developing new chronic conditions, and it improves your prognosis and outcomes if you've already got a health condition, which is really important. Fitness, the gold standard for measuring fitness is using an exercise stress test, where you wear the mask on your face and all the air you breathe out gets analysed by a metabolic analyzer or a fancy computer. And the minimal clinically important difference, so the smallest change you can get where you yourself will notice the improvements as well as having improvements in clinical outcomes, is 1 MET, or 1 metabolic equivalent, and this is roughly equal to 3.5 mils of oxygen per kilo of body weight per minute. And normal healthy range, so if you're regularly physically active for at least 3 to 6 months, you will sit between 8 and 10 METs, or around 30 to 35 mils per kilo per minute. Right, so this fancy diagram I'm going to break down, but basically this figure is particularly looking at people with existing health conditions and their clinical outcomes and risks of mortality. So basically anything to the left of the big vertical line means you have a decreased risk. So with a higher fitness versus having a low fitness. So the further along you are to the left, the bigger the impact. These are the different patient groups. So mostly around the cardiovascular space, but also includes kidney, lung conditions, and cancer. And then these are the different outcomes that they looked at. So the top left one, all-cause mortality. We can see from the far right box, it's all reduced risk with higher versus lower fitness in various chronic health conditions. And then they've also looked at the same with cardiovascular disease mortality, heart failure mortality, and adverse events. As I said, the most common way to assess that is with a great big exercise test. So some of you may have done a stress test, you may or may not have had the mask on. but it's expensive equipment. It needs a very specially trained health professional to run it, which isn't available to everyone and isn't necessarily common practice in a lot of parts of Australia. So another easier thing that we can look at is steps per day. So this is more the physical activity side of things. And on the graph on the right-hand side, we're looking at the steps per day from 2,500 all the way up to 20,000. And generally speaking, the more you do, the lower your risk of all-cause mortality is what this specifically is looking at. And we can see, I don't know if you can see my pointer on the screen. Might go across. The biggest benefit comes in the earlier stages. So going from not much, or around 3,000 steps per day, to around 8,000 steps per day is where you get the most benefit. Most of you have probably heard of the 10,000 step per day rule challenge. That was actually an arbitrary number picked out by a research study group. And the more and more research that we have on looking at steps per day and what it associates with different clinical outcomes, it's actually around 7,000 or 8,000 that gives us the most benefit. You do get extra benefit beyond, but it's not a whole lot in terms of bang for your buck. So if you're aiming for 10,000 steps per day and you're not quite getting there, rest assured that 7,000 or 8,000 is more than enough. The other thing to consider, so on the left-hand side of the screen, is for every 1,000 step per day increase, you have a 12% lower risk of all-cause mortality. So if you start off at 3,000 steps per day and then in a couple of weeks you're averaging 4,000 steps per day, you've lowered your risk by 12%. All right, so how do we assess physical health? So we have the physical assessments, questionnaires, and devices. Physical assessments, you've probably all or most have done a 6-minute walk test. This is the most common fitness assessment in cardiac rehab, and something that's emerging, particularly in clinics that don't have a lot of space, is the 1-minute sit to stand test. The incremental shuttle test is another fairly common assessment. And then, as I mentioned before, you have the graded exercise test, also known as a exercise stress test or a VO2 max test. And that's just shown with the picture on the right. So it can be done on a bike or on a treadmill, depending on space and equipment availability, breathing into the mask, and then all the air that's breathed out is getting analysed by this fancy computer. Not a fun test to do, and unfortunately it doesn't matter how fit you are, because you're going as hard as you can. It all feels horrible at the end. So another way that we can assess our physical health is through questionnaires. So the simplest one is probably the physical activity vital sign. So on average, how many days per week do you engage in moderate to vigorous physical activities? Second question is, on average, how many minutes do you spend during these physical activities? Multiply them together and you'll get rough minutes per week. The next one that I've got here is the International Physical Activity Questionnaire. Most of these questionnaires are available online as well. The International Physical Activity Questionnaire, there's 2 versions. There's a short version, which is 4 questions. So one that asks about moderate physical activities, one about vigorous physical activities, walking, and time spent sitting. The long version, which is about 27 different questions, breaks it down a bit further and looks at job-related physical activity, transport, leisure time, and then housework, I think. Household chores is the other one, and then sitting as well. So it looks at it a bit more in depth. It does take a bit longer to go through, but if this is something that you're interested in tracking at home and working on particular areas, it can be a really handy one. The Duke Activity Index, so we come back to that METs or metabolic equivalence. And basically you go through each of these questions. Can you do them without difficulty or issues? So number 3, can you walk a block on level ground? And that's, if you can, it's equivalent to about 2.75 METs. And my mental maths isn't good, but let's choose another one that's easier. Let's say I run a short distance. It doesn't describe what short distance is, which is a bit of a pitfall. It could be 10 meters, 50 meters, or if you're a long distance runner, short could be 1 kilometer. And that's equivalent to about 8 METs, which is about 30 mils per kilo per minute. So if you do that, you're doing pretty well. And yeah, so you can work through each of those questions and see what the highest rating one that you can do without any issues. And that'll give you a rough idea of what your top capacity or fitness level is like. That particular one, the Duke Activity Index, is available online. So MD plus Calc. If you Google Duke Activity Index, it'll usually give you an option and you just click yes or no for the different questions as to whether or not you can do it, and it'll give you a score at the end. Devices. So we have pedometers and accelerometers. These are usually for looking at movement, daily steps per day, and sedentary time. So it can include smartphones and watches. You can just get normal basic pedometers that you clip onto your shoes and just wear it around during the day. Most smartphones these days can automatically track steps per day, which is handy if you have your phone on you. So if you always have your phone on you, that's a handy one. You don't usually need any extra devices or technology for it. You usually just have to open the app. It's a very quick setup and it'll start automatically tracking. The figure on the right shows all the different types of devices that you can get to measure various different aspects of health. So from mobile phone and tablet apps, headbands, shoe insoles, smart garments. These ones probably aren't as common, but smartwatches is definitely one. Other devices or measurement opportunities include the DEXA is the dual energy X-ray absorptiometry scan. So this is most commonly used for bone density, so to gives you a good idea of bone health, and if you're above 70, you're normally eligible for it. Otherwise, if you have a break that probably was a bit unexpected, then you'll probably have a bone density scan as well. These scanners can actually also look at body composition. So it's a different type of scan on the same machine, but it can tell you exactly how much muscle, bone, and fat you have and where it is in your body, which can look really cool because it's a nice colourful picture, but it can also be a little bit confronting. The other one we have is metabolic analyzers. So these are the ones that they use for VO2 max during exercise. A lot of clinics can also use it at rest to look at your carbohydrate versus fat utilization and looking at metabolic health that way. And then the last one I've got on here is dynamometers. So this looks at muscle strength. So you might have done it with a grip strength test. That's a dynamometer. Applications. So these are some examples of some general health applications. So the first two are for Apple and Samsung. They're automatically on the smartphone. You normally just have to open up the app the first time and then it'll start tracking. And if you have a device such as a smartwatch, you can link that to this app and it'll track your steps and your movement. A lot of them will give you estimates of VO2 max or your max fitness. I don't actually know what the equation or the algorithm is for it to do that, but what I've seen so far seems to be relatively accurate, which is pretty handy. And then you've got Fitbit and Google Fit. So all of these apps look at general health. So they can track things like your sleep, your heart rate, your skin temperature, if you're linking your devices up to it. I don't know what else they do. You can track other aspects of health. A lot of these apps, you can put in your medications as well, so you have a record of it there. And then we've got apps that are specific to exercise. So the most common one is probably that I'm aware of is Strava. So you can link a device. So on the far left-hand screen, you can link your watch and your phone up to it. You don't even need to have a watch. As long as you've got your phone, you just remember to take it with you. On your walk, your run, your hike, your cycle, and it'll track it and map it out. The cool thing about Strava is it's quite community based, and people all over the world will use it and will track different activity routes. So if you go to a new place and you want to try out a walk, you can go onto Strava and see what other people have logged in the area, and you can follow one of those tracks. So that's a nice handy one to do. Then you got MyFitnessPal is a similar thing. You do get some apps that are specific for lifting. I don't have much experience with those ones. And the other app that I've got on here is a 6-minute walk test app. I couldn't find the one that I used to use, so I'm guessing it's no longer a thing anymore. But this one is something that you can set it up, and if you find a 20 to 30 meter flat surface, so if you don't have that in your home, which most people don't, or the office, the distance between wickets, like at your local oval, particularly coming into summer, if the cricket pitch is set up, wicket to wicket from memory is 20 or 25 meters. So you can use this app and you can walk backwards and forth, back and forward to do your 6-minute walk test, and it will track your distance. If you've linked it with a smartwatch, you can have a look at how your heart rate goes during that as well. So if you know what your 6-minute walk test result was during cardiac rehab before and after, you can continue to track your fitness outside of that, either using the app or just a stopwatch on your phone if you find a known distance. So how do you know what's right for you? It really depends on your health and exercise goals, and what technology you already have or can get. I know a lot of people get gifted Fitbits and heart rate monitors after they've had a heart event for peace of mind for friends and family and for the person themselves. If your goal is to just generally be active, usually just monitoring your steps per day on your phone or with a smartwatch is enough. Most phones will give you a summary per day, per week for the last month on how many steps per day you're averaging, and you can use that to track how things are going. If you want to be a little bit more tech savvy, you can connect your heart rate monitor or your smartwatch to the different apps that are available. You can use it to see, I don't know if all watches do it. If you're going to get a particular watch, see if it gives you an estimate of VO2 max, and you can have a look at that. You can have a look at your heart rate recovery after a bout of exercise as well. So the quicker your heart rate comes down, as long as it doesn't make you feel dizzy, the quicker it comes down, generally the healthier your cardiovascular system is. And that's it. Short and sweet, but happy to take any questions. I'll just stop sharing my screen.
Wonderful. Thank you for that. Feel free to make me a host again if you like. So we can go from there. Really nice summary of information and evidence around the importance of physical activity, exercise, and obviously some of the digital options available to us. A couple of questions I got, because I guess it's also been an area of mine over the years, is I'm curious to get your thoughts. You know, many people on this or who'll be watching it later are patients or a consumer themselves.
Yep.
How easy is it to actually use these type of devices? So whether it's a polar heart rate monitor or a Fitbit or an app, I mean, do you recommend that consumers kind of look up how to set this up and go about themselves? Do you recommend that they perhaps get some help from a professional, because there's a lot of information that can be provided through these devices, I guess, to help people be more physically active. But from a layman person, it can be perhaps a little bit confusing.
Yeah. Yeah, definitely. There's a lot out there. A lot of the smartwatches these days are actually really simple to set up.
Hmm.
And they'll take you through it step by step between the phone and your watch, and you say, okay, you put it on your preferred hand, you say right or left, and then you put in the app which side you put it on so that it's aware of where it's going. And it'll say, like, for example, this one, they don't want it too far up, they want it on a fairly flat part of your wrist. If you do need help, you can either ask the shops, or if you have a friend or family member, they're normally fairly simple. Some of the, like you mentioned about the polar heart rate strap, which is normally just a chest
Hmm.
strap that you wear, that can be a little bit more tedious depending on the brand that you get. But yeah, most of the stuff that I'm aware of that consumers and people get are going to be the watches, and they're usually fairly simple and straightforward. And if you need to, the shop assistants are normally more than capable of setting it up. And then you can talk to a health professional about the different aspects that are in the app and what they mean, and whether you need to or want to track the various options that are in there.
I guess, look, I appreciate that one. And one other question, I'm kind of curious. Any recommendations, even for clinicians, around the use of digital? I mean, is there something simplistic? I mean, I know you rolled out a whole heap of suggestions, but is there something that, if you had to pick one or two, for instance, whether it's if people have an iPhone and maybe they just use the app, the fitness or the health app to track steps. And obviously we know 10,000, as you said, was a bit of an overestimate. We're looking at now, what, 6,000 steps a day or 7,000 steps as a target for people with cardiovascular disease. So yeah, is there any suggestions that you could make yeah, for some consumers who may be interested?
Yeah, steps per day is definitely the easiest. And it does. So when we look at that physical activity versus exercise, most people will spend their time walking around, whether it's pottering around in the house or out in the garden. And the watches, which include an accelerometer, so it will measure movement in all directions. So it's pretty good at picking things up. Unfortunately, it's not so good. So this is probably a bit more of my experience. Pushing a pram, if you have your hand on there, it's not going to count the steps that you have. But if you have your phone in your pocket, they actually do really well at talking across, and it will, at the end of the day, it will pick up all those steps. So
Mhm.
steps per day is the easiest. And a lot of, even, so if you do have a watch, for example, you can track different activities on them. You can select the activity that you're doing, whether it's a walk or a cycle. Some will automatically pick up, particularly if you walk for at least 10 minutes, it'll
Mhm.
automatically start tracking it for you anyway. The watches are really handy if you have more specific goals. If you're just looking at getting generally more active, usually just the steps per day is fine to look at.
Right. All right. Well, thank you. I don't think I have any other questions that come through the chat. Just so you know, this is circulated to our groups, and people do watch this later on, at our peer support groups or online via our website and YouTube channel. So, Nikki, on behalf of Heart Support Australia, thank you so much. We really appreciate you giving up your time to give an insightful summary of physical activity and exercise, and using digital and wearable devices. So we do hope that this provides some real important impetus for consumers, and I guess even healthcare professionals to look at this more, and to really help improve those targets of getting people more physically active. We know there's a big mortality benefit with more physical activity or exercise that you're doing, and also your outcomes with cardiovascular disease are far better. So I can't stress that enough. So thank you again on behalf of Heart Support Australia. Thank you. And this wraps up our Heart Support Connect series for 2025. So all the very best, and we'll reach out again in 2026. You take care.
Cool. Excellent. Thanks, Christian.
Thank you.